Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. In 2019, I posted a video about the risks and benefits of benzodiazepines in a response to a story we saw about Jordan Peterson. Now, he's a well-known psychologist and he has a YouTube channel. Evidently, he was on benzodiazepines. I believe the medication specifically was Clonazepam. He tried to stop rapidly and ended up developing severe symptoms of withdrawal. More recently, we see another update about Jordan Peterson from his daughter, Michaela, about his struggle with Clonazepam. Due to this latest update, I received a number of questions related to this situation, related to what happened to him and benzodiazepines and Clonazepam in general. I will attempt to answer these questions in this video. So, a few important points before I get started. I'm not diagnosing anybody here in this video, only speculating about what could be happening in a situation like this. And I have very limited information about this situation. Essentially just a 3-minute video we see from Jordan Peterson's daughter that was posted on his channel, and some information we saw in a post that she made last year on her YouTube channel. Also, I have a PhD in counselor education and supervision. I'm not a physician. If somebody's on benzodiazepines and wants to come off of them, they need to seek medical supervision. So before I get to the questions, I'll take a quick look at what we see in this update that was posted. So Jordan Peterson was taking Clonazepam for some time. His wife became ill. His dosage was increased, and then he attempted to stop rapidly and developed withdrawal symptoms. Evidently, in addition to the withdrawal symptoms, he also developed what's referred to as a paradoxical reaction, and I'll talk more about that when I get to the questions. This complicated his withdrawal, and eventually he sought treatment in Russia. Evidently, it was a gruesome detox that he went through. He spent 4 weeks in intensive care. But now he is recovering, which is good news. Evidently, Jordan did attempt tapering and micro-tapering prior to going to Russia for treatment, but those strategies were not successful. So now let's take a look at some of the questions I received about this. The first questions: what is a paradoxical reaction, and does somebody really need to go into a hospital, a detox facility, or some similar facility if they have this reaction? So a paradoxical reaction is when somebody has unexpected symptoms caused by a medication. With benzodiazepines, these reactions are characterized by being talkative, excited, having excessive movement, and we see this update from Michaela Peterson specifically referenced akathisia. We see emotionality and sometimes rage and aggression. The pathophysiologic mechanisms underlying these reactions are unknown, so we don't know what causes paradoxical reactions. There are a few risk factors, though, that have been identified: a prior diagnosis of a major mood disorder, a personality disorder, alcohol consumption, being very young, or having advanced age. Now, I'm not aware that Jordan Peterson really fits into any of these risk categories, except possibly for the major mood disorder. If I'm not mistaken, he's talked about depression before. It's not clear if he has a diagnosis of depression, but evidently he's been treated for depression on previous occasions. The most popular strategy for addressing a paradoxical reaction is to discontinue the benzodiazepine. But of course, this has to be done safely. It can be dangerous, sometimes even leading to death if somebody stops benzodiazepines quickly. Now, sometimes another medication is added into the mix when there's a paradoxical reaction, including a medication called flumazenil, which is a benzodiazepine antagonist. When safely done, discontinuation resolves the symptoms the vast majority of the time. Now, to answer that other question, does this need to be done in a hospital or similar facility? Yes, this is actually a dangerous situation, and it must be managed carefully. Fortunately, paradoxical reactions are rare. Less than 1% of individuals who take benzodiazepines will experience these types of symptoms. Moving to the next question, in this latest update, we see that tapering and micro-tapering did not seem to work for Jordan Peterson. They weren't successful strategies for his situation. So the questions here are, what does it mean to taper or to micro-taper, and does this strategy usually fail? So to taper off benzodiazepines or any medication means to reduce dosages slowly over time. A micro-taper is simply a smaller decrease of the medication over time, right? So it's just a matter of speed. Taper is reducing dosages over time. Microtaper is doing that same thing, but more slowly. So smaller decreases at each time interval. These strategies are usually successful, again, under medical supervision, but the experience is highly variable. Some people can get off 2 milligrams a day of clonazepam within a couple of months by gradually reducing the dosage over that time period. For other people, it could take 2 years or more to do the same thing. There is really no universally accepted taper schedule for clonazepam. We see some research literature that explores the idea of dropping the dosage by 0.5 milligrams every 2 weeks for people who have been on clonazepam for more than 3 years. In terms of the success rate for this schedule, we see that 70% of the participants in the study were able to taper at this pace without having panic attacks. But that's just one way to measure a successful withdrawal. That doesn't mean that those people weren't suffering from other symptoms. It just means that they avoided panic attacks. For the other 30%, of course, they had panic attacks and likely a number of other symptoms as well. Another taper schedule that we see is where somebody reduces the dosage of clonazepam by about 5% every 4 weeks. And we see different versions of this. We see 10% every 4 weeks, 5% every 2 weeks. So of course, a schedule like this is going to take a long time, and we don't have a lot of good results about how effective this schedule is. But it's believed that the vast majority of people can maintain this schedule without severe withdrawal symptoms. So with that in mind, what's the problem? Why doesn't everybody just go with the slow tapering schedule? Well, there are two main difficulties that come up. One is you have to have the support of the prescriber to go on that type of extended taper schedule. And the second is mechanical difficulties with getting the dosage right. So let's take a look at the first point here, prescriber issues. I've mentioned many times before in other videos that I believe it's important for prescribers and counselors to work together for the good of clients. Most prescribers are highly conscientious and do a good job, but unfortunately there's a lot of bad information about how people become dependent on clonazepam and how people can get off of clonazepam. Prescribers are not immune from consuming this bad information. Some prescribers will not allow a slow taper because they believe it's an attempt by the client to extend the use of that particular drug. They refer to this as an endless taper. Now, I understand this concern. Certainly some people who are dependent on substances do extend the taper longer than necessary. But clonazepam is an unusual medication in that it often does necessitate a long taper. It worries me that some prescribers jump to distrusting clients as a first instinct. If a client has a history of abusing substances, the chances that a prescriber will be dubious about a long taper increase dramatically. Now on to the second point, mechanical issues. This seems like a strange problem to have in a society that has access to all kinds of technology, but one of the difficulties we see with a long taper of clonazepam is it becomes nearly impossible to cut the pill precisely enough so that the dose is accurate. Clonazepam is a highly potent medication. The smallest dosage pill available is 0.5 milligrams. If somebody's trying to reduce their dosage by 5% every 4 weeks, for example, they would have to shave off 0.025 milligrams from that half milligram pill. This is very difficult to do. Now, one easy way to get around this would be if clonazepam was available in a lower dosage tablet, like a 0.1 milligram tablet, but unfortunately it's not. Another possibility for some clients is to use what's referred to as a compounding pharmacy. A compounding pharmacy can create liquid clonazepam, and somebody can reduce their dosage using an eyedropper. So they have a lot of control over the amount of clonazepam they're removing as they continue with the taper. Moving on to the next question. Jordan Peterson obviously has access to substantial financial resources. What happens to individuals trying to withdraw from clonazepam who do not? Unfortunately, a lot of clients are left to face benzodiazepine withdrawal on their own or with clinicians who have a limited amount of skill or experience. Financial resources not only grant access to better treatment, they grant access to clinicians who are more likely to believe the client. I talked about that before, how some prescribers distrust clients. Wealth also provides access to a variety of choices. Most people wouldn't have access to facilities in Russia or really anywhere outside of whatever country they live in. I've worked with clients who didn't have the resources to get halfway across town, much less halfway across the world. This really stresses the importance of prescribers having knowledge about benzodiazepine withdrawal. People can't always just go and find another prescriber who does understand their situation. Sometimes they only have access to one prescriber, and unfortunately, some people don't have access to any prescribers to help them. Moving on to the next question. Considering this frightening scenario with Jordan Peterson, should benzodiazepines not be used anymore? The difficulty with benzodiazepines has really always been the same. They are typically very effective at reducing anxiety, and they can be used to treat other symptoms as well, but they have risk associated with them. Some people can tolerate short or long-term usage of benzodiazepines without really hardly any problems. Other people have a great amount of difficulty. Again, we just see a lot of variability there. Benzodiazepines certainly have a place. I don't think simply taking them away as an option really makes sense. For some people, they're the only class of medication that helps them. But I do think appropriate caution is warranted. For every frightening case like we see with Jordan Peterson, where he suffered a lot and his life was in danger, there are dozens of cases where people take the medication and they're just fine. In a way, it's similar to opioids. Opioids can be dangerous, but they're also an important medication that's used to control pain. And some people need to have them. The answer isn't banning an entire class of drugs. The answer is education. And by education, I mean education for the prescriber and for the client. Clients should know the risks of using benzodiazepines before they take them. What happened to Jordan Peterson is terrible and frightening. A lot of people are surprised that a mental health provider could be affected by this type of situation. I talked about before in the other video on this topic that this is actually quite common. Mental health clinicians can become dependent on substances just as easily as people who are not mental health clinicians. And in terms of unusual reactions like that paradoxical reaction, that doesn't just happen to people who aren't mental health clinicians. I hope that some good can come out of all the suffering we've seen here in the form of an increased awareness about the risks of benzodiazepines. Now, I know whenever I talk about topics like withdrawal symptoms, there will be a variety of opinions. Please put any opinions and thoughts in the comments section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be interesting. Thanks for watching.